Hello everybody, my name is Stephen Green and I am presenting Impact of ER Fear Factor on Emergency Department Volumes during the initial months of the COVID-19 pandemic. We have no disclosures. So everyone remembers back in March 2020 when the lockdowns began, and public health messaging at the time was overwhelmingly urging people to stay at home. A month later, the CDC reported that emergency department volumes fell 42% nationally. This coincided with an increased rate of out-of-hospital cardiac arrests and decreased admissions across the country for emergencies like ACS and stroke. Now, exploring possible causes for this, the data suggests that there is a possible correlation between knowledge of COVID-19, concern about contracting COVID-19, and healthcare seeking behavior. However, no studies have been done to show a definitive correlation between these three factors. And our study set out to determine if there was a correlation between these three factors. And our hypothesis was that COVID-19 knowledge will be associated with ED care-seeking behavior and level of concern for COVID-19. Our study was a cross-sectional observational study, and our data was collected using Qualtrics software. Our study population were patients presenting to the emergency department at University Medical Center in Lubbock, Texas. And our study took place over the course of June and July of 2020. After collecting demographic data, we asked participants about how many times they had presented to the emergency department during the first 3 months of the pandemic and during the previous year in order to determine how often they came to the emergency department at baseline. We also asked about care for specific symptoms, including respiratory symptoms, chest pain, back pain, abdominal pain, and pelvic pain. They were asked to rate at what intensity level of these symptoms they would seek emergency care for these symptoms both before and after the pandemic began. If there was a difference in these values, we used that difference to estimate their aversion to the emergency department visit in the initial months of the pandemic. Our survey also included a 10-question quiz about common public knowledge about COVID-19. We calculated a knowledge score that was the total of all correct answers of this quiz. Now, for our results. Our average participant went to the emergency department 1.25 times during the first 3 months of the pandemic. Interestingly, elderly patients were 16 times less likely to use the emergency department in the initial months of the pandemic than those less than 40 years old, which is the opposite of normal trends. Now for the change in pain threshold. 69% reported no change in their pain threshold both before and after the pandemic began. However, 24% reported an increased pain threshold to seek emergency care after the pandemic. Those who reported concern for contracting COVID-19 at healthcare facilities had an increased pain threshold, which validates it as a measure of aversion to seeking healthcare during the pandemic. Elderly patients were more likely to have a higher pain threshold than younger. However, individuals with chronic health conditions were 70% less likely to report an increased pain threshold to seek emergency department care. So for our specific symptoms that we asked for, 45% reported they were less likely to visit the emergency department for respiratory symptoms than in the prior year, and 32% reported that they were less likely to visit an emergency department with pain symptoms that we listed compared to the prior year. For our knowledge scores, the average score was 7.09, and it was found to be negatively associated with the number of ED visits during the initial months of the pandemic. An increase in 1 point on the quiz was associated with a 29% decrease in likelihood of being a heavy ED user. However, it was not found to be correlated with higher pain thresholds for seeking emergency department care. So, breaking it down, concern for contracting COVID was associated with a decreased perceived need for ED care. Higher COVID knowledge scores were associated with lower utilization, but they were not associated with a change in pain threshold to seek ED care, so our hypothesis was rejected. Searching for other explanations as to why there would be this increased anxiety for getting ED care, we looked to our stay-at-home orders. They have historically led to decreased ED use, particularly in natural disasters, and they have been correlated with decreased ED use during this pandemic. Stay-at-home order timeline also coincides with an excess death rate that surpassed that attributable to COVID-19 alone. Decreased ED use by the elderly in our study is particularly concerning because this is a vulnerable population and is particularly susceptible to missing critical care if they do not have the normal access that they normally get. This is a possible adverse effect of the very aggressive public health messaging that was occurring at the beginning of the pandemic. Interestingly, heavy users continue to be heavy users despite concern for COVID-19. So, limitations of our study. Our biggest limitation is our selection bias, because our study population were people who already had decided to go to the emergency department. So, in conclusion, patients' knowledge of COVID-19 seems to be a contributing factor to their care-seeking behavior, but it is independent of their level of concern for contracting COVID-19. Furthermore, public health messaging was effective at teaching the public about basic COVID-19 epidemiology and prevention. However, it may have had the unintended consequence of increasing anxiety about interacting with the healthcare system, leading to possible missed critical care among particularly vulnerable populations such as the elderly. So, I think we would all benefit in some nuance in public health messaging and encouraging people to seek appropriate health care for their conditions. Using my references, thank you very much.